Dr. Anshul Goel here today, and let me just tell you what Dr. Anshul has achieved. He has achieved a rank of 109 in Aipg 2015. He has scored a rank of 101 in PGI Chandigarh, and not just that, he has scored a rank of 183 in the AIMS November 14. I congratulate this wonderful person, a great doctor, Dr. Anshul Goel here today. Dr. Anshul, DAMS is proud of your achievements, and tell us how you are feeling about it today.
I'm very happy. Actually, ecstatic is the word. Seriously, it was my dream and it has come true. I don't think there are any words to describe this feeling. I am like on cloud 9. Seriously, so happy that I worked so hard for it. It's been 2 years and finally my hard work has paid off. Really, really happy for it.
And let me tell you, Dr. Anshul, it's not that you are on cloud 9. We feel equally happy on your achievement, and from the bottom of our heart, we congratulate you on the wonderful ranks that you have scored in various exams. It's not an easy task. You have worked really hard for this.
Yeah, thank you. Thank you so much.
Let me just ask you formally, what is DAMS' role in your achievement?
I think joining DAMS in March 2014 was, I think, the best decision that I have taken so far. And I'm not just saying that for the sake of saying, I feel it from the bottom of my heart. All the teachers, all their notes, each and every guidance at every step, it has been so wonderful. It's been a magical journey, I would say. From morning 8 a.m. to evening 8 p.m. You know, the 12-hour session didn't look like that we are getting, we have achieved so much, we have gained so much from this class, from their guidance, from their notes. It's been really, really good. I would say my decision was perfect to join DAMS. There's no doubt about it.
I may ask you one more thing here, Dr. Anshul Goel. The DAMS is quite active on the online things, right? Yes. And I would definitely say that you would also agree that DAMS Exclusive Club and DAMS Online Test Series and the DAMS CBT exams are something very exclusive to the names of DAMS. How do you put these things, in your experience with DAMS?
I think it is very essential because today all the exams, almost all the exams except PGI are online. So it is very essential to get accommodated according to that. And I don't know any other institution but DAMS who is conducting all the online test series. It's been conducted, I think, every week or every month. And there is CBT to get the real exam experience. That's what they say. And it is actually very good. I would say that taking regular online test series and final CBT, for that matter DVT and all other online test series, I think it's really good. It's a real time, I would say, exam experience beforehand, so that you get accommodated first of all to the online thing. Second, time management, because if you go on doing all the answers on OMR sheet, it will not be useful in today's time, because as I said, all exams except PGI are online. So it is very essential to get oriented to that type of questionnaire, that type of study that DAMS is providing us.
That's nice, and I would also like to tell our listeners here that DAMS is the only institution who has changed its regime, all the curriculum as per the NBE pattern. No other institute is doing that in the country. I think, Dr. Anshul, you would also agree to that?
Totally, I agree with that.
Let me ask you here, Dr. Anshul, did you attend the DVT session?
Yes, of course I did.
How was your experience?
I think it was wonderful because it was like a mini revision for me in those 3 days. Actually, to be very honest, I was very apprehensive about all these image things and the critical one-liner that they used to ask, all the percentage type questions, because these are not usually covered in the normal teaching. And especially taking time aside for DVT, I was apprehensive because it was taking away 3 days of mine in that crucial period. But after attending that, and I would say on the first day itself, I started feeling that it will for sure prove to be very useful. And actually it has been, because in those 3 days almost all my subjects got revised. First, second, the fear in my mind from that images and those percentage type questions were off. So I was like, only I have to study notes now, and I don't have to worry about all these images. I don't have to flip over my textbook to see all those images, the surgical instruments, ophthal instruments. And especially in Obs Gynae, ma'am told us so many one-liners, so many percentage type and those figure type questions. I think that was very useful.
So what you're trying to say here with your conversation, with your inputs, is that a positive feeling was inculcated in you
Yes.
by attending these sessions. Apart from the consolidation of of the theory part, definitely
Yes.
that positive feeling came and that fear went away just by attending these
Yeah,
sessions.
Sure.
That's great. And let me just take this conversation to the next level and let me ask you, in your entire time that you spent with DAMS, when you joined DAMS and till the time you were there ready to take the final exam, the AIPG exam or the AIMS or the PGI exam, what difference did you feel in yourself?
Okay. I would say I was more focused before joining and after joining, because before joining last year I got I think 2217 rank in AIPG, and all of my friends, actually everyone was saying that I had to take surgery. So they were saying that you will get a decent college, so you better go ahead with it. But I was not sure in my mind whether should I take or whether should I drop. So I talked to Sumar sir and all those faculties, and they said that because you have achieved well and this was your first attempt, go ahead, join the TND. Previously I joined the regular course, and let's see what happens. So I thought I think it will be worth it, because after joining it, every test that I gave, it was like that subject was over. Like I used to study for one whole week for that subject. First I used to go ahead with the notes, then all the MCQs, and in the last on Saturday or Friday I used to again go ahead with the notes once again, and then I used to give the test. So it was like I was so confident on that subject that because I knew that after this I would be flipping over to this subject only after like 5 or 6 months. So I have to be thorough with this subject. So it was like there's a vast change in confidence in me. Like in May when I joined the TND, and in September end when I went off with when the TND session was over, in I think almost all the subjects, I was more confident, I was more focused. I would say I was more sharpened. I knew that now, okay, I can achieve it. It was a confidence builder, I would say.
And let me tell my listeners here that Dr. Anshul is not just saying that he had traveled and he was more focused. That is very much evident from a rank of around 2000 last year to a rank of 109 in AIPG 2015. This is definitely an incredible change. Congratulations on that. And let me just ask you, how actually did you prepare? What was your mix of success, of securing such a good rank?
Okay. First of all, I would say notes. Take your notes as your Bible. These notes that these teachers, each and every one of them, all the 19 subjects notes are tremendous. They are marvelous. They are really, really nice. I would say that last year my rank, it would have been much better if I would stick on to the notes. So first of all, I would definitely recommend DAMS regular notes. They have been the best. Okay. Then secondly, MCQs. It is essential, and nowadays subject-wise MCQs are more important than those 10-year guides. So I did my, first of all, I made sure that I am thorough with all my notes, class notes. After that, as I said, I joined the TND course. So first of all, for I think 1 or 2 days, I used to study the class notes. Then for rest of 3 or 4 days, I used to complete all my that subject MCQs, the question answer and some of the theory part, some of the explanation. And then again, if time remained, I used to again flip over the notes. So it was like in one whole week, I used to study notes twice and did the MCQ once. Then I went ahead with the test. Usually the rank what I got in the test was good. After coming back, I used to study all the notes that were covered in the TND, all those questions, TND questions, the TND notes, and once again I used to do the notes, that subject notes. So it was because that I'm saying this because I used to study for these notes 3 times in 1 week. So it was like I was very much confident in those notes, because last year I saw almost I would say 80 to 90% of the questions were from notes directly. Okay, that's why I repented that if I would have done the notes much better, I would have got a better rank last time. But that I realized in May. So I would say notes. Secondly, all the subject-wise MCQ books for all the 19 subjects is essential.
Okay, and let me ask you about the DAMS study material. You have been referring in your conversation about your notes. Is it your notes or is it a combination of DAMS notes or the DAMS study material? Kindly enlighten us on that.
Most of it is the handwritten notes, the class notes. Some of it I think for 2 or 3 subjects, I refer to those DAM study material, because for like physiology and I think in pharmacology, PSM, because in PSM all the updates are there, and in DAM study material I found those last looks very very nice. They were like in a very concise and short book. They covered almost whole of the 19 subjects. So all those 4 last looks and those recent updates, they were really good.
That's nice to know. And let me just ask you one more thing here, Dr. Anshul Goel, that the entire time you spent in the classroom regime with us, how did the evaluation system help you in your evaluation?
Okay, that's what I'm saying, that all the teachers, all the 19 subject teachers, they played a very vital role in this preparation. In the regular batch, I used to wrote down all the notes. In the T&D, it was like a revision of the notes, and the notes were more enriched after attending the T&D, because all the updates I used to add in the notes itself. Then they used to tell some new things, that this new has come up in this year, or this you have to change because the old guidelines have changed now. So all those notes were getting consolidated. They were getting more refreshed, more updated.
Did the test conducted in the classroom and the grand test also help you in your assessment and preparation?
Yes, obviously, because all those class tests, the T&D test and grand test is like they take the grand test once in a month. So it's like initially you may not score that well in the grand test when I started my preparation, but eventually as the time goes by, you cover more and more subjects. So eventually your performance in the grand test gets more and more better.
Okay, Dr. Anshul, I would like to know that which faculties in DAMS influenced you the most?
Oh, I can't name one. Seriously, from the bottom of my heart, each and every one of them. The first name that comes to my mind is Sumar Sethi sir, obviously, and Deepthi Bahl ma'am. And I would say from first year, Pradeep sir, Anupama ma'am, Poonam ma'am. Then for Patho, Sanjeev sir, Pharmac sir, microbiology teacher Parth Rakshit sir. Then Ruchi Rai ma'am, Rajiv Dhawan sir, PSM faculty, all the medicine staff, the neurology sir, then the Arvind Chaudhary sir, Rajiv Tiwari sir, Rajiv Sharma sir, Tushar Mehta sir. I'm sorry if I'm forgetting any name, Prabhanshu Bhushan sir. They all have been so wonderful, they all have been so kind, so open about everything. You can go and ask any query anytime you want. They will not hesitate at any point of time, be it on club or be it personally. And they used to cover the subject so well, and apart from the subject also, they used to deal with us personally on a personal level so well, so that apart from the study itself, we used to ask so much personal questions like, you are in apprehension whether we'll clear it or not. Is it going to be possible? Whether we'll do it in the end? Whether we'll achieve it? They used to be like so motivating. It was very helpful.
That's nice, Dr. Anshul. You have been telling us so honest things. Let me ask you one more thing here. Which branch are you going to opt?
I'll opt for surgery.
Any special reasons to that?
I've been a fan of surgery. It's my dream. Even if I would have secured rank 1, I would have gone ahead with surgery.
Well, we definitely wish you all the best in your future endeavors. And before we conclude this conversation, this interview of yours, any message to the future Damsonians or PG aspirants?
Okay. The ones who have joined DAMS, excellent decision. The ones who have not, please join DAMS as soon as possible. If you have not joined DAMS anytime, I would suggest go ahead with the regular course. If you have done regular course and you are going to for the second attempt, I would suggest T&D course. Because why DAMS? Why I'm saying DAMS is because they are so much updated. They are constantly doing something or the other to come up with a book or with some material or with some class sessions, counseling sessions. First of all, you are updated at every time. Secondly, the club. This club has been amazing. All the queries has been answered by all the teachers. You can ask at morning 3 a.m. and they are available. They'll try to answer it as soon as possible. All the teachers gave their email IDs. You can ask any query anytime you want. That is what I'm saying, that it has been a really good golden decision of mine to join DAMS. I would strongly recommend each one of you who is aspiring to get a good rank, join DAMS and you can see the difference for yourself.
That's nice of you, and thank you very much. I congratulate once again Dr. Anshul Goel here.
Thank you.
Who has secured a rank of 109 in Aipg 2015, a rank of 101 in PGI Chandigarh, and a rank of 183 in AIMS. Thank you very much. Wish you all the best in your life.
Thank you so much, sir.
I think